So, David, did you have a ticket to the Rotunda?
I did not have a ticket to the Rotunda, but I was here in 1985, the last time they had to do that as well, and I actually was counting on it. And this is my 11th presidential inaugural since coming to work in Washington in policy.
Well, you certainly have me beat. I was trying to go through, and I think I'm up to nine, maybe 10. So it's interesting. Where would you like to start? I was thinking, given that it seems like recently different presidential administrations have started with a flurry of executive orders. Maybe we could start there, just talk about some of the healthcare related or healthcare adjacent executive orders that were issued on the first day after the inauguration.
Yeah, it is also always something that would happen to some extent, but it's become a much bigger, higher profile moment in the inaugural process. President Biden used it heavily in 2021 when he got sworn in. And so, it's becoming something that's kind of expected. It's part of an aggressive way in which to do. And I think it's also a natural byproduct of having a very divided government, very small margins. And that's also true about the American electorate. It's also very divided with different opinions.
Yeah, so maybe we start there and just sort of talk a little bit about what an executive order does and doesn't do. So, I think it's important for people to realize that this is something that presidents have used. It's a tool to set sort of federal policy. However, it does not come with any sort of it can't include any sort of financing. So no discretionary funding or entitlement funding follows an executive order automatically. And it really takes either the courts or another sort of future president to unwind an executive order. Is there anything you'd like to add to that in terms of that quick description of executive orders?
No, no, I think the first example of an executive order will go straight to exactly what you're talking about. A lot of other threads are at play.
Okay, so let's start there. So I know you wanted to talk a little bit about the executive order around drug pricing. So help us understand what happened in terms of the executive order, but also the implications, especially since there was recently sort of legislation on this issue.
Yeah, this is a perfect example of where you kind of scratch your head and realize someday it'll either end up in the courts or back at Congress. And so basically one of the executive orders that President Trump did sign um, went after and tried to rescind the process laid out in a previous executive order around price negotiations in Medicare and Medicaid. That was something that for years the government was never allowed to do because Congress didn't allow it to do it. They literally did not have the authority to do that. And in 2022, when the Inflation Reduction Act passed at the end of 2022, that's when they created a new program. And the first year was 10 drugs, and that's just recently been finalized. And the next year after that's supposed to be 15. So while they redid and rescinded this executive order Biden had done about working in this capacity, the catch is that the Inflation Reduction Act of 2022 is still in place. It is still law. So last the last week before the inaugural, the Biden administration went ahead and announced the next 15 drugs that it was going to be going to do negotiations with. The first one, of course, being one of the main weight loss drugs. So you've got a legal process still ongoing. So, a lot of things that were done in the first couple of days, I think were the setup. And it's almost like a posturing position saying, if we want what we want, and if we're starting here, and if we have to go down another pathway into the courts, we will do that. So we shall see.
Yeah, it's interesting too, because one of the comments I made as I was going through all these is, clearly attorneys and law firms are going to be incredibly busy over the next couple months and years. Um, just really quickly before we move to the next one, what do you see happening over the next, say, 6 months with this issue specifically?
It's interesting because this is one of those that you would think would really set off a lot of voters, that they would be very upset about this. This is, I mean, the expense of pharmaceutical drugs, prescription drugs, is very high, as everyone knows. We've had the no surprise billing from hospitals, and this is kind of that version of that. But I think that probably what we'll see a lot of public discussion about will not be about this particular aspect, but they will go after the pharmacy benefit managers as they were going after them before we got into the holiday break. So I think they are the ones who are being set up to be the bad guys, and really go after them in such a way.
So there was also an executive order on the Affordable Care Act and the expansion of enrollment periods. Can you tell us a little bit about what the executive order said, and then we can get into kind of where we think this one's headed?
Well, this has been a tip. This has been very much a seesaw back and forth. Um, During the first Trump administration, they had, and before that administration, the Obama administration had used all of its authority to expand the enrollment periods for the Affordable Care Act. And so when Trump came into office during the first term, they went after that and tried to really constrict those. This time they made that one of their number one things. So they are going to limit the use of funding and any other executive authority to make the expansion period go, any more than it should. So that's how we've got for this year, we've got a record-breaking number of new enrollees in the Affordable Care Act. And it's the highest number we've ever had. But those were used as well. So I think you'll see some numbers seesawing back and forth in the next couple of years because of this. But it is an ongoing battle about the Affordable Care Act, which, has been around for quite some time now.
Yeah, it's interesting because these first two, drug pricing and the Affordable Care Act, really have become, these are things that I think the majority of voters would be in opposition to what's being proposed in the executive orders. And it'll be interesting to see sort of how the administration and Republicans in Congress kind of thread these needles, because they clearly campaigned on making some of these changes. And so, it's hard to predict now sort of what the reaction is going to be. And then, as you said, and I think you said it insightfully, this is really the beginning of a much longer negotiation between the administration, Congress, and really that in this case, the Department of Health and Human Services.
I couldn't agree more.
So shifting to a third area of AI, and this one's a little wonkier. So they rescinded the safe, secure, and trustworthy development and use of artificial intelligence. Help us sort of understand what this is one where the Trump administration is undoing an executive order by the Biden administration. So help us sort of understand this issue.
Well, one of the things about all of these that rescind something is it doesn't necessarily mean that the Trump administration doesn't want to have them at all. It means that they want to structure them differently in some cases. And so I think that's one of the situations here. So back in 2023, then President Biden did do an executive order on this, as you just said, rescind the safe, secure, and trustworthy development and use of artificial intelligence. And this is the obvious stuff that you think about in terms of like, okay, putting guardrails to make sure that however something's used, it doesn't harm patients and so forth. So there's a lot to be done in this space that requires reporting and also requires data sharing with the government. I have a feeling that some of that is what they want to remove or to modify. And also, we all know that there's been a lot of discussion about the diversity, equity, inclusion stuff. I think that that's probably one of the things that they are going to go through all of these executive orders and kind of try to water that down or remove it. And that's kind of, I think, one of the things that when I look at that one, so I don't think that they're going to say, no, we don't want artificial intelligence. They're just, I think, probably going to say, we don't want to set this up the way the Biden administration was setting it up. So, and that's what elections determine as to who's going to put together the government and how it's going to be run. So we shall see. We just, The ASN has its own task force on this issue, and they are working very much around the importance of artificial intelligence in healthcare. So we will remain interested and engaged.
I think part of the issue here is there's even sort of a conflict, I think, within the community of people that are investing in trying to develop AI. And you're right. I mean, I think the right word to use is guardrails. And um, I'm not sure how you do that without a federal role. And I think a lot of people would look at AI not dissimilarly from, national security or disaster relief, where there is a big federal responsibility. But clearly, a lot of the people that are supporters of the administration and have the most to gain would like as little federal intervention here as possible. So again, I don't see how this plays out sort of across partisan lines. It seems like the only way to move forward in this arena is in some bipartisan fashion.
Yeah, yeah. And we've always had longstanding, different views on how to let industry grow in this country and when it needs to be regulated and when it shouldn't be. And that is that's a healthy conversation that we've been having in this country for quite some time. And it is here, and it's still not to be determined exactly where this goes, because I'm not really sure exactly where this goes. But then again, none of us are sure exactly where AI is going to go.
Yeah, and I think that is a sort of an aside here, just to talk a little bit about the executive order on immigration. This is one that's not like AI. It has huge implications for sort of the future of healthcare in this country. It's not clear at this moment exactly how the executive order will affect immigration, because it was much more narrowly focused on sort of using authority that the first Trump administration had used for where they used the pandemic to sort of use it for rapid expulsion of immigrants at the border. That doesn't have a direct impact on sort of as we think about some of the implications for healthcare. However, there is this sort of split within the administration between the sort of Doge or Dodge group and the traditional sort of MAGA group around H-1B visas, around the visa program for highly skilled people coming in the US. I think it's too early to sort of predict how that's going to play out, but it's clear, this is an administration that would say it got elected on immigration being one of its key planks of its platform, along with energy and inflation. And so it's hard not to think that this is going to be sort of a continuing discussion over the next few months and beyond.
I agree. I agree. But I think the visual image that we've seen some in the last couple of years of people flooding through fences and into the southern border just has a different impact with voters than you do with high skilled workers getting special visas. I do think that they represent things fairly significantly different.
Yeah, and I guess the nuance, and this is probably something we should consider exploring in a future episode, is when you're thinking about people at the border, particularly if there's any sort of security, ultimately that becomes the Department of Health and Human Services in terms of providing, humanitarian support there. Versus when you think about visas and immigration, that ends up with Homeland Security. And so you have this interesting, I don't even know how to describe it, this sort of dichotomy here in terms of the different agencies and what they're trying to accomplish from a federal perspective.
Well, let's go to something that I think is it sounds very ominous, but I think it's more kind of it was designed to be more of an image thing, and that has to do with the World Health Organization. How do you see that one, Todd?
Yeah, so that's an interesting one. So basically the executive order is pulling the United States out of the WHO. As you said, that is from a symbolic perspective, going to be very important. Also, the US is the major sort of contributor to the WHO. We provide about $130 million a year to support its efforts globally around tuberculosis and HIV and vaccines and things. So there is this both important role that the WHO plays, as well as the fact that the US is a major supporter. I think this is one where we could be pretty specific about nephrology, in the sense that one, historically, the International Society of Nephrology, ISN, has been recognized by the WHO as representing the community. So any efforts that ASN has related to the WHO are through the International Society of Nephrology, and ISN has worked very closely with the European Renal Association and ASN, and then a series of specific sort of national organizations when appropriate to try to advance policy. I think the second issue, which is really important, is that currently the WHO does not recognize kidney diseases as a non-communicable disease. So really, there's not a nephrology or kidney disease or kidney failure presence at WHO. And so while this on the surface, I think, is an important issue, and as you said, I think the symbolism is really important to both the new administration and their supporters. I think from a nephrology perspective, it's not clear to me exactly what a potential response would be. Obviously, we're going to have a conversation with the ISN and ERA to see, what we can do to be helpful, but I'm not sure beyond that what we could be doing, unless there's things that you've thought of that, we should chat about now.
No, I think this is one of those interesting moments where you're going to have to really be honest with yourself and say how much of that work is dependent on the World Health Organization to do. When I think about HIV/AIDS, I don't think about the WHO first. One of the places I think about that first is the Bill and Melinda Gates Foundation. There's other places that do some of the stuff. That's not to write off any of the stuff that's insignificant. But I mean, I just, like I said, I feel like there's a lot more kind of symbolism here than there is anything else. And, I can, we'll just have to wait and see how it gets played out. We do have a multifaceted international world now that kind of responds to many, many different things. And so we'll have to see on that one.
Yeah, and I guess, maybe is the sort of final point, which is another one where I think we're going to have to sort of wait and see is, both you and I live in Arlington, Virginia. You live closer to the Pentagon. I live closer to Arlington Cemetery, but we both live, very close to the downtown DC and where most of the federal government is. And it's pretty clear that the administration has also sort of laid the groundwork in terms of really reevaluating how we think of civil service, and that's going to have huge implications for the Department of Health and Human Services and the agencies within it, like the National Institutes of Health or the Centers for Disease Control and Prevention or the Food and Drug Administration. Not clear to me now what that's going to look like, other than I'm sure that you and I have a lot of neighbors and friends and people we know who've been in government a long time where they're using this as an opportunity to move on professionally and try something different. And I do worry about a lot of the institutional knowledge and what's going to happen just in terms of the people who day to day keep federal programs moving forward, particularly for the most vulnerable Americans.
Yeah, I get that too, but I do think I think there's some amount of positioning going on here, encouraging some of those people who are probably thinking about retiring to go ahead and do so. There is a serious conversation going on in Congress about how big the federal workforce should be, and should it all be located here in DC, or should it also be somewhat moved out to the rest of the country, where some of the members of Congress think that it would be much more, beholden to the rest of the country as opposed to just being here. And there's a lot of ways to see that particular conversation. And then you have the COVID impact, which is people having gone to, like telework for a great deal of time. And you and I both know, and Lauren knows, it's like you can walk by all those buildings near where our offices are, and you can see a lot of space that's really not being utilized as much as it was. And that discussion is becoming very active as well. So I think that's where we are. Bottom line is there's a lot to be waiting and seeing, but at the same time, we're not just sitting around for somebody to tell us. We're working on it.
Yeah, and I think maybe that's where we close. It's just, it's really important for us to identify what our priorities are as an organization, what's best for the millions of people living with kidney diseases, including the 37 million Americans living with kidney diseases, and focus there and really focus on where we can make the biggest difference. I would remind our audience there is an executive order that still exists from the first Trump administration that's on advancing American kidney health. That executive order is something we can point to in our advocacy efforts in terms of saying, this is federal policy, and this is why it's important for the government to continue investing in these programs. And there's been a lot of progress from that executive order through the end of the first Trump administration, through the Biden administration, and now at the beginning of the Trump administration. So there are opportunities here, and I think we have to be very clear and very focused as we move forward. So David, I will give you the last word, but thank you for taking the time, and Lauren, thank you for producing. And David, what's your outgoing advice to all of us?
My outgoing advice is that we just try to get through this cold and look forward to the spring. And there's a lot that's going to be happening here, and exactly how it's going to all shake out, I'm not quite sure. And but I think that I do know that spring will be here before long, and I've got my eye on that.
Great. Well, thank you, David.
Thank you.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.